Dr. Susie G and Joanne Milios. So I use a lot of y'all's knowledge and clinical based stuff.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronski, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Hi, Dr. Mills. Welcome to my channel. It's so nice to have you here to talk about a very important topic of men's sexual health and pelvic health around prostate cancer.
Yes, thanks for having me.
Of course. So tell us a little bit about what sparked the passion around men's pelvic health for you.
So I had an interesting start into men's pelvic health. It wasn't really on my radar. It kind of happened just through a conversation with another therapist who explained to me that there was a huge need for more pelvic health physical therapists in general. And then that there was a very low level of men in the space, males treating males. So when I realized that need and when I realized how underserved it was, and in most typical cases, there's a high level of motivation to get your genitals working at a higher normal level again.
Indeed.
It coincided with what my plans of, being in the CrossFit and weightlifting space, they meshed well. So I gave it a chance, and, fast forward 4 years later, 5 years later, now we're doing it. So it's been a good journey.
Yeah. Well, and being that you're from Louisiana, Baton-Rouge area, there's a higher population of men with just prostate cancer post-treatment that started to seek help. And so that's the population you're working with at the moment?
Yeah. So that's the majority of my caseload, by way of just referral and word of mouth. And it's kind of been like not a slippery slope, because slippery slope sounds negative. It's been like a snowball effect of, I treat one male. Like, it really, the biggest snowball happened. I ran an ad in the paper. I talked to this guy who is a representative of the Advocate, which is a local newspaper here, like a week into the shutdown. And I had already started doing it somewhere else, but then whenever I started my own practice, it kind of took a back seat, and I was treating more CrossFit people. And then I ran this ad, and I got one call and started doing virtual with this guy. And that one call just kind of opened up a lot of different doors. And now it's, I'm treating 50% pelvic health, 50% ortho in my practice. And there's a big need for it. I would say the vast majority of my clientele are people that have chronic incontinence. I base what I do a lot off of, I feel like the two giants in the men's pelvic health space are Dr. Susie G and Joanne Milios. So I use a lot of y'all's knowledge and clinical based stuff to treat these guys. And, in an ideal perfect world, I would like to see people 5 times before they have surgery and 15 times after, based off Joanne Milios' research. But a lot of times guys find me when they've had erectile dysfunction and incontinence for several years, chronically, and nothing else has helped. And then I see them, and then we get good results. So yeah.
There's hope, and that's awesome. And that's really,
there's a lot of hope.
The series that you and I are doing together, Dr. Mills, is educating the community about prostate cancer rehab from our physical therapy perspective, and that improvements can be made. And the sooner that we address the rehabilitation process, the better the outcomes.
Absolutely.
So this is where we're at, folks. So Dr. Mills and I are going to do a 3-part video series here where we're going to first talk about the before and after of a prostate, after prostate cancer. So whether that's radiation or having a prostatectomy. And then the second video, we're going to be talking about tips to improve or completely get rid of incontinence. So treating incontinence from a rehabilitative perspective. And then sexual recovery will be our last video in this series. Is what does penis rehab look like? What are the expectations around sexual recovery? And some things that you can support yourself through that process as well. So, and Dr. Mills, you, through this, your journey as a clinician, we were talking off the air, but you had mentioned you have an app now that you use with folks called Prosfit.
Prosfit, yes. It's a, so we describe it as a hybrid program. Whenever I'm treating guys in this realm, usually the norm is, ideal 5 before, 15 after, basically 15 to 20 weeks of rehab. And the explanation that we always give is you're going to be seeing me once a week, right? I do 90-minute evaluations and 45-minute follow-ups. So the 45 minutes that you're going to be seeing me is going to be a lot of teaching and a lot of learning the finesse and coordination of how to do these movements, but application is everything. So what you do outside of our treatment session is going to be way more important than what we're doing in the treatment session. And, we found that a lot of guys just did a lot better when there was more tracking, more accountability, and the progressive, loading that we do in our rehab, and as well as tracking pad weight is huge, and it keeps them on track. So we have hybridized the rehab process, and we do a lot in person, but we also do a lot through the app Prosfit. So
wonderful. That sounds really great. And what a way to, yes, the accountability piece, the coaching pieces, and helping people stay motivated through the process. It's so easy, when you're dealing with something that's challenging, it's like a fish in water. You don't know anything else but wet. So it's, and no pun intended there.
Absolutely. That was a strong pun.
Honestly,
that was a little on the nose.
I was like, wait, no pun intended there. Yes, no. And not to minimize this at all, for sure. Because it's distressing and very challenging, very frustrating.
Right.
To experience that. And so what we're getting at is, there is hope, there's recovery. And through this video series, our intention is that this will help empower folks to take control over their situation and to doing the things they love, and finding, reconnecting with meaning again. Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.